Hello, this is Mr. Neil Writer, consultant audiologist and director of Clearwax. Thank you for joining me in what is another demonstration video of our recently developed WAXscope. The WAXscope is due to be launched early autumn 2022. If you are interested, please email info@clearwax.co.uk and we shall add you to our mailing list. I have a patient here who attended with crusted dry skin, so dead keratin. And you can see the glossy appearance of this. And dead skin, one of the characteristics of dead skin keratin is that you do get this glossy reflective surface. They do have a very narrow ear canal, so I'm just using our smaller 3.5mm speculum here. So these speculum, they come in 4 different sizes: 3.5mm, 4.25, 5 and 5.75. And with the WAXscope, what's unique and great about it is that the speculum itself attaches to the WAXscope and it's disposable, and it has an intermediary channel whereby you can insert the instrument, and that means there's no risk of cross-contamination of earwax or debris between patients. So I've just detached that wax plug using a fine end suction tip. I then went in with some forceps just to grab it, but then I opted then to revert to St. Bart's ear hook, and we're just going to get behind this. You can just see that clarity and that magnification, and I'm just going to tease this out. Now the patient, you'll see in a moment, they were suffering from a glue ear on this side, acute otitis media with effusion. You can see the effusion, we'll see it in a moment when I get it in focus posteriorly. They do have a retraction pocket. Now I'm just going to mop up a bit in the ear, and we're going to come back to the eardrum in a moment, but you had a quick glimpse there. So we just got some residual keratin just on the base of the ear canal, so the floor of the ear canal. I'm just going back in with, I think this is a fine end suction probe, but given how magnified it is, it can be mistaken for a standard Zollner suction probe. And again, you can see that reflection, and that's another characteristic of skin, dead skin keratin, you just get a reflection. Just peeling it away. There we are. So slowly going to extract this out of the ear, and then you'll have a view of the patient's eardrum. So there's the effusion posteriorly. You can see the yellow fluid, and then the tympanic membrane is retracted, it's inflamed. It's a little hair strand just there in the way, so, but nonetheless you can still have a fantastic view. I'm just refocusing public. You can even see the capillaries, blood vessels on the eardrum if you look closely. Same patient, this is their left ear. Now they were concerned that they had a perforation in this ear. They have suffered from perforations in the past. They generally spontaneously self-heal. They were just reporting discharge and weeping, so they were a bit worried. And we again just started off with the suction probe, but it's just too crusted, this, and I'm trying to lift it off the canal wall. I'm peeling it away from the back part of the ear canal. But similarly to the patient's first writer, I'm going to use an ear hook in a moment. And again, that's what's great about the WAXscope, is that you're able to use all ENT microinstruments to perform earwax removal. You can see this skin, now dead skin, it acts like double-sided sticky tape. Not only does it attach itself to the canal wall, but it also envelopes itself around the wax or the skin plug. Now I could be going at this for the next half an hour possibly with suction, and it still may not come out. So we can't, when we, as a clinical ear care specialist, we can't be solely reliant upon performing just microsuction. We need to be skilled and proficient with St. Bart's ear hook, for example, or Jobson horn, and also forceps. So I'm just inserting it, I'm just trying to get in behind, and I'm just lifting it up and away, and out of the ear we are. Now with this patient's eardrum, posteriorly, it's slightly bulged, slightly opaque, It's quite dull in appearance, but there's no evidence of a perforation or even a pinhole perf. But it is slightly bulged. Now they do have glue here this side as well. I performed tympanometry pressure test. There's no evidence of a perforation, but a lovely view. Well, I hope you enjoyed that video, and if you are interested in the Clearwax WAXscope, please do email us at info@clearwax.co.uk. Thank you. Bye.